Guys, why vomiting causes cardiac arrhythmias? This is very important and bizarre high-yield USMLE concept. Let's discuss this. Multiple vomiting episodes cause the loss of the gastric acid HCl, which shifts the plasma pH in the favor of metabolic alkalosis. Now, when kidneys detect this change in plasma pH, kidneys respond to this change in plasma pH by excreting excess bicarbonates from the blood. And to do that, kidneys basically to excrete excess bicarbonate, kidneys have to reabsorb proton ions in the collecting duct, and for every proton ion being reabsorbed from the collecting duct into the blood, every potassium ion is kicked out of the blood into the urine. That leads to the potassium depletion or potassium loss into the urine. In addition to the urinary potassium loss in response to the metabolic alkalosis itself shifts potassium ions from the extracellular space into the cells. And for every potassium ion moving into the cells, proton ion moves out of the cells to counterbalance the high pH of the metabolic alkalosis to maintain electroneutrality. Both these processes of urinary potassium loss and intracellular potassium shift causes the serum potassium to drop. And how this drop in serum potassium levels affects cardiac function? Actually, serum potassium levels are required to maintain the resting membrane potential of the cardiac myocytes. When serum potassium levels drop, the resting membrane potential of the cardiac myocytes become more inactive, which in turn leads to the hyperpolarization and delayed repolarization of the ventricles, which is reflected on the ECG as prolonged QT interval, flattened T waves, and appearance of the U waves. Now, prolonged QT interval is a precursor for torsades de pointes, which is a polymorphic ventricular tachycardia that can degenerate into ventricular fibrillation and sudden cardiac arrest.